For a look at the latest in TB treatment, barriers in accessing these services, research and development for treatment and vaccines at a community level, we're now joined via Zoom by Dr Regina Osih, who's the Chief Global Health Officer at the Aurum Institute. Thanks very much indeed for joining us and welcome to the program.
Thank you very much for having me.
TB, although it's something that people know about, it's not something that people talk about as often as I guess is required, given the number of lives that are impacted by TB globally each year. And also particularly as we look back this year, yes, global deaths have decreased since 2000, but we've seen an increase in the last year. That must be quite concerning.
Yes, indeed. I mean, I think that TB has always been the #1 infectious disease killer in the world, except for the last 2 years where it was surpassed by COVID-19. And being the fact that COVID-19 also got transmitted in similar ways and has similar symptoms, the fact that healthcare services were not necessarily available at some point in time during hard lockdowns in many countries really created a situation where a lot of people with TB were not diagnosed and were not put on life-saving treatment. So TB is actually eminently treatable. It is a long treatment course, minimum 6 months. Now we're getting closer to 4 months. But it is something that does require quite a robust health system to be able to detect and to be able to get people on treatment. And when that doesn't happen, a lot of people are left behind.
All right, so and I know that one of the big themes this year is looking at children and adolescents. And one again doesn't often think about that age group when we're talking about TB, particularly since the advent of things like HIV. And yet they are a vulnerable group as well.
Yes, for sure. I mean, children under 5 are particularly vulnerable to TB, and they're one of the target groups for a preventative treatment. Children that are over 5 and sort of 5 to 15 are also high risk, although they're currently not part of the groups that we target in terms of TB preventive treatment across in South Africa in particular, although the WHO has updated their guidance to be able to include those groups as well. We do know that children are at high risk. Unfortunately, children also are more difficult to diagnose with TB. They don't have typical symptoms. It's more difficult to find the TB when they have it. And so you have to be particularly vigilant in those groups to make sure that you are reaching them either with preventive services or with curative services when they do get ill.
All right, so we've been living with this pandemic for 2 years, and I just wonder how we've been able to try and work alongside COVID-19 in treating TB patients.
So I think the key thing is that, you know, with the pandemic being 2 years old, we need to start pivoting. We did a lot of emergency measures. We put in place some measures to make sure that we could diagnose COVID and take care of COVID while it was, raging. But now we have to sort of think about integrating TB and HIV and all other infectious diseases with the COVID-19 response. And so I think that it's really important for the health system to start considering how do you best integrate case finding for TB and COVID at the same time, because obviously the symptoms are similar. It's usually respiratory symptoms. The lungs are the ones that are affected. And so people, when they come into the clinic onto a primary healthcare setting with symptoms that are respiratory symptoms, they could potentially also have TB. And so you have to make sure that you're testing for both illnesses at the same time. There are also many similarities in terms of how things are transmitted. And I think there is actually, we're not yet sure in terms of the decrease of TB in the world. It's also possible that because of people wearing masks, people not being in crowded spaces, that some of the TB could have decreased. We'll find that out through research over the next couple of years. But I think it's really important to start looking at ways to integrate all of what we're doing and making sure that we're addressing people holistically when they come to our primary healthcare facilities.
What kind of work has your institute, for example, and work across the continent generally been involved in terms of finding responses to TB?
So we've done a lot of work in TB research and also in TB programmatic implementation, as well as HIV. The mainstay of a big program that we have right now is a program on TB prevention, where we're trying to figure out how to best improve access to a much shorter course of TB preventive treatment, which can save lives by preventing people who have TB, latent TB infection, from developing active TB. And that's a project that we're running with the help of partners in 11 different countries. And we have our own offices in some of these countries, especially in Africa. And we're hoping that through this program, we start socializing the idea that TB preventive treatment really should be something that is accessible to everyone, and that countries should really try to figure out a way to get uptake of that, because without prevention, we're really not going to be able to end the TB epidemic in this world. So we really have to push forward to trying to get everybody on preventive treatment. People who are living with HIV in particular are very vulnerable, so that's the first target group. We discussed children as well, under 5, that's the second target group. And then we have the third target group, which is contacts, household contacts, people who live in the same households as other people who have TB, who are at very high risk of developing the disease. And that's also a group that is targeted by the WHO to be able to access life-saving TB preventive treatment.
Yeah, prevention is better than cure, for sure. So 2020, global spending on treatments, diagnostics, prevention was half of that was targeted. I suppose part of the battle is going to be a more concerted effort in terms of putting resources into this process. What's holding us back, do you think?
Well, I mean, I think there's a limited amount of resources, or so we thought before we got to COVID. We know that TB, for example, has been an area that there's been a lack of investment in for many years. We've had TB since the dawn of times, but a TB vaccine investment has been about 1,000 times less than what was invested in the COVID-19 vaccines, for example. And with investments, we see results, and we can see that with the COVID-19 pandemic and the treatments, the vaccines, and everything that were available within 2 years. Whereas with TB, we've been languishing around with similar knowledge about technologies for many years and haven't been able to move anything forward. So I think that it's about political will. It's about understanding whether, we all want to prevent this disease, or whether we want to cure the disease, whether we want to get vaccines out there. And until we all decide that this is a priority, like we did for COVID-19, I think that is going to be really difficult to continue with having this type of investment, which is completely subpar, to try to address the TB pandemic.
One of the issues I remember over time has been that TB has started to develop some resistance to drugs, and that there's sadly some people who do get drug-resistant TB. Are we finding ways to deal with that? Is new research finding new treatments? How are we doing on that front? Because that must be one frontier that we really need to kind of tackle quite urgently.
Yes, and in fact, South Africa was a big focus of the extensively drug-resistant TB epidemic that happened a few years ago as crises were increasing. But there again, I think there was a massive amount of investment that was given into the development and discovery of new drugs. And actually right now we have a very good regimen that's available for people with extremely resistant extremely drug-resistant TB, which is it helps you to be able to treat the disease in 6 to 9 months, which wasn't something that was available. A few years ago, it took 22 months of sometimes IV drugs, being in a hospital, being separated from your family to be able to be treated for MDR and XDR TB. So there are definitely advances, and we welcome those. And there have been updates in guidelines to be able to make sure that we are getting to the point where everybody has access to those. But there's still a lot of work to be done in TB just generally. So I think that, it is testament to the fact that we are able to move forward when we want to, when there was a threat in terms of the drug resistance of TB. I think a lot of new things happened. There was a lot of innovation. There hadn't been innovation in TB for a very long time. And I think that we need to ride that wave going forward to sort of really harness some of those innovative approaches, some of those new drugs that are available, and actually new vaccine technologies as well, to be able to, get to the point where we can really sort this problem out once and for all.
All right, Dr. Osih, it is World TB Day, so perhaps as a final thought, what would you like to share with the public, given the work that you do and the things that you've been researching? Because there must be things that we can do to help in this battle if we, A, were aware and a bit more conscious. What is that message to the public in general?
Well, I think, we always have problems with people when there's a lot of stigma. TB is still a stigmatized disease. People, associated with a lot of things. It's a disease of poverty. It's a disease of lots of, social ills. I think that what the message would be that everybody should care about TB. We don't know when we're next, and that COVID-19 has shown us that we're all vulnerable to infectious diseases, and that, we can't just say this is a disease of the other. It's a disease of the people in the townships. It's a disease of people who, don't have the means, and it's not going to affect me as a person. I think we all have to pay attention to it. We all have to pay attention and put resources into it so that we can actually get to the point where everybody can enjoy a healthy life.
Dr. Osih, thank you so much indeed for joining us, and we wish you strength with the continued and important work that you're doing. Thank you so much for your time.
Thank you very much.
Wonderful. All right, that's Dr. Osih with the Aurum Institute. She's the Chief Global Health Officer there, talking to us on World TB Day.